Some pregnancy advice, like don't drink or smoke, we've all heard before. But here are 5 tips you may not know for having a healthy pregnancy. Don't eat for 2. Despite the saying that pregnant women are eating for 2, you should not be eating twice as much during pregnancy. You need an average of 200 extra calories a day for the last 3 months only to fuel your baby's growth and keep yourself healthy. That's the amount of calories in an apple with 2 teaspoons of peanut butter, or a glass of skimmed milk with 15 baby carrots and 5 tablespoons of fat-reduced hummus. Gaining a lot of weight during pregnancy may make you more likely to have a big baby, which can make birth harder for both of you. Talk to your midwife about healthy weight gain in pregnancy. Sleep on your side. Starting early in pregnancy, it's a good idea to get used to going to sleep on your side, ideally on your left side. That's because once you reach your 2nd trimester, lying flat on your back can cause your growing uterus to compress a large vein called the vena cava. When this important vein gets compressed, it can affect your blood circulation and make you dizzy. Of course, we all change position when we sleep, but getting to sleep on your side helps to prevent these problems. If you're only comfortable on your back, try leaning onto a pillow placed behind you. Take care when changing cat litter. Cat feces can spread a parasitic infection called toxoplasmosis. If you get toxoplasmosis when you're pregnant, it may cause problems for your baby, such as eye or brain damage. Sadly, it can even lead to stillbirth. The infection can also come from other sources, such as raw and undercooked meat. So cooking and washing food properly is even more important than usual. If you have a cat, ask someone else to change the litter tray. Changing the litter daily is best, since the parasite doesn't become infectious until 1 to 5 days after it leaves the cat. Keep your cat off the kitchen counter and wash your hands after petting him. Also, be careful when gardening or handling soil or sand where cats may have been. Use gloves outdoors and wash your hands well. Look after your teeth. Brush, floss, and get regular dental care. This is particularly important during pregnancy because hormonal changes can make you more susceptible to gum disease. Many pregnant women become more sensitive to the bacteria in plaque, leading to swollen, bleeding and tender gums, a condition called pregnancy gingivitis. Untreated gingivitis can develop into a more serious form of gum disease that affects the bone and other tissues that support your teeth. If you haven't visited your dentist in the past 6 months, make an appointment for a checkup straight away. It's free during pregnancy. Most dental care can be done safely during pregnancy, but let your dentist know you're pregnant so he can take appropriate precautions. Keep up to date with immunisations. First, the flu jab. Pregnancy can make you more vulnerable to flu complications such as pneumonia, which can make you very ill. Your GP should offer you the seasonal flu jab to protect you against these complications. The immunisation won't hurt your baby. In fact, getting the flu jab can protect your baby from the flu after birth, when he's too young to be immunised himself. It's best to be vaccinated early in the flu season, between September and November. But you can get the jab safely at any time in pregnancy. Second comes the whooping cough jab. Whooping cough, also known as pertussis, is highly contagious and can be life-threatening for newborns. The whooping cough vaccine in pregnancy is part of a combined vaccine your baby can have later when he's 2 months old. Having the vaccine in pregnancy protects your baby against whooping cough until then. Your midwife should offer you the jab when you're between 28 and 38 weeks pregnant.